this is Dr. Daniel McGrath. Wanted to take a moment, as I think is appropriate, to inform not only my existing patients, but the public as well, in terms of what we're doing and what's going on with the practice under these current circumstances. Obviously, everyone has been affected by COVID-19. We here in Texas have obviously been affected by this. We are taking every measure that is appropriate to ensure not only our staff safety, but our patient safety as well. Currently, under the current circumstances, obviously we're not open and available to see patients on a day-to-day basis, and we're not able to perform any elective surgery under the existing executive guidelines from the governor. However, with that said, we are still able to do a lot of communicating with our patients via telemedicine, utilizing both FaceTime, WhatsApp, as well as other telephonic devices that allow us to have direct communication. That being said, we are still able to do consultations that are face-to-face, as well as manage our existing patients' questions, concerns, medical needs, and the like. We wanted to make certain that all of our patients in our database, as well as potentially future patients, understand that we are still here. We are prepared and ready to go as soon as this executive order is lifted, and we will be ready to go full steam ahead. I have taken the position to maintain my staff, to keep them on the payroll, so that when this order is lifted, we'll be ready to have a green light and move forward just as we normally do every day. But obviously, in this period, we have to adjust the patient flow, and we can't be allowing patients to come in and just be seen for direct consultation or follow-ups. That's one of the reasons why we're going obviously to the telemedicine platform, which we have the capability of doing very easily. As far as what we have done to prepare for this ongoing crisis, after the executive order came down, we realized that we weren't going to be seeing patients on a daily flow. The first step that we took was to completely wipe down and sterilize every area of the office, including the front reception region, as well as all of the operating rooms and patient consultation rooms. That has all been done. Moving forward, when we do open for business again, we will likely be seeing patients with the noted guidelines that are in place, gloves, masks, etc., until we know that this virus is completely under control. So rest assured that when you come in and you're seen, we'll be in a position to make sure that you stay safe and that we stay safe. During this crisis, we're maintaining daily communication with our patients. Our phone lines are manned, and for individuals that have questions, or even potentially individuals that want to get more information but can't do so in person, we still have the ability to do a virtual consultation with somebody, just simply filling out the online form on our website for requesting a consultation, even answering a question, and we can certainly still do that. Moving forward, obviously this is not going to last forever, and there will come a time when we can all get back to normal. To put a little bit of reassurance into the mind of patients that will be coming forward, we typically in the hair restoration industry function as a relatively low flow daily type of practice. We're not typically seeing 20 and 30 people a day. That's how many medical clinics are. Hair restoration is a different animal. We typically work with just one surgical patient daily, and we have gone and taken measures to ensure that all of our staff have been evaluated. Nobody is come in contact with anyone who is infectious, and no one currently has any evidence of infectivity whatsoever. The reassurance that I want to give my patients moving forward is that when we are reopened, they're going to be in a safe zone. They're going to be one patient being worked on And everyone that's working on them is going to be utilizing every safety protocol that we need to have put in place. As a bit of general information for my existing patients, the Governor of Texas has put in place an executive order that as of now is due to lapse come April 21st. We would ask that all of our patients, many of whom are on the schedule now for April, late April, and potentially throughout May, I would ask you all to please, as best you can, exercise as much patience as possible, because we're all living in a very fluid situation. It is very possible or conceivable that that executive order may be extended beyond April 21st. If we have to move a surgery, please understand that it's not because we're trying to be difficult, but rather follow the regulations that have been given and handed down to us directly by the governor.